So, for him, competitive powerlifter, I'm going to have him walk through how he gets set. Don't say anything, just do it. We'll talk about it real quick. This is not a workshop on the bench press, but I'll just kind of re-highlight what we talked about in lecture. So just do your thing, bro. What's that? Whatever you want, full setup. Wrap it up. Maybe spot. Everybody comes in? Good spot. Fucking good. So.
Those are pretty short.
That's all right. Go to the four. When you protracted and put it back in the rack, I was like, it's like when you see somebody that's like they're tripping, you're like, don't fall, and you just watch them. Fortunately, it didn't fall. Okay, so now what do? So let's go nice and slow. So go ahead and start off. I'll just have to kind of stop. So he's there. He's rocking back. He's walking his shoulder blades together, and then what he's going to do is he's arching himself, but then if you notice, he's going to push himself into his shoulder blades. Yep. And then he gets in here, and what else does he do? Then he pushes his shoulder blades down more. So he's driving his shoulder blades, scapula, together and down to get it into a super powerful position that's not necessarily centrated. Now it's a better position because, remember, when the shoulder blades are retracted, he's able to keep his glenohumeral joint in a more mid-range position, which is way better for force production and way better for the tissue in the shoulder. So now he's getting set there, he's arching up and driving down to get this up as much as he can. And then I think you have to have heels down for you?
Yeah, absolutely.
So then he's lowering his heels down. Now, if we had a force plate right here, it's barely touching. And then he's gonna go ahead and set his hands now. He's keeping all of this tight. And then he's gonna sort of like lift off. And now he keeps the shoulder blades together. He's driving down here, and when he comes up, do you supinate on the way up? No. Drive it back up, then go ahead and rack it. So now, in that position, you can see that he's arching a ton, he's retracting his shoulder blades, and he's got a wider position of the hands. Great. So all of those are wonderful performance. If I told him that he has to stay in a 3-month position, it's not going to go well for his performance. But for him, yeah. So the thing I love about this class is you have to sort of, we're trying to, fit a square peg in a round hole, so to speak. So a lot of you guys brought up weird sport examples, like, well, what about this? The answer is, have we evolved to bench press 315 for sets of 6 at a body weight of, 160?
Yeah,
165? So no, we haven't done that. So now we're just training our bodies to do something amazing and silly at the same time. So we want to find a way to best do that maximizes performance and minimizes the load on the tissues of the body. That's what we're trying to do here. So in this case, I can have him come up into a 3-month position. I still want you to actually kind of pull the shoulder blades back a little bit.
Just don't actually.
So this is a compromise, right? We want the shoulder blades back because I don't want them to just be abducted and depressed. I want them to retract a little bit, so go ahead and lay back. And then I'm going to put you in 3 months. So now he can kind of be here. He's going to get the shoulders in a better position. Why are we doing that again? Because it keeps the glenohumeral joint in a more mid-range. If he's protracted, he's going to get to end-range horizontal abduction, and that's going to pinch the shoulder. If we bring it back, this is in the bottom of the bench. If he retracts, you see how that reduces it. So retraction, closed chain, is horizontal adduction from that position. Is that too, you guys get it? I think a couple people get it. Good enough. So go ahead, grab the bar, and now you're going to bring your feet up, so bend your knees all the way up. Good. I usually will have them start, bring it up here a little bit, and you're going to try to pressurize down into here. Good. And just breathe into here. And now, nice and easy, just keep that. Take it out of the rack. Now this is actually becomes more challenging. He's doing a decent job here. So I'd say nasal breathing. Go ahead. Yep, you're good. Okay, just like that. And he's just going to keep this pressure here. Go ahead and break down. Same thing. Keep the pressure, drive it back up, good. Then keep it going, so breathe in, breathe it out, good. Breathing in, and breathe out. Now, stay there if you can. So when he's driving out of the hole, actually let's stand you up, I'll show it. So face me though. So when he's, stand up. So when he's pressing and he's coming up, so let me move you. When he's coming up, what you want to do, you want him to think, drive the shoulder blades down and out. What are we getting when he does that? Serratus and lower trap, to lat too, I guess, but so drive him down and then just press it in my hands, and he's getting really good scapular depression and abduction as he's doing this. Now, in the bench is going to block that, which is one of the negatives of the bench. You can't move your scap very much. But you want to think shoulder blades down, ribs down as he's driving. Why do the ribs down matter? Pressure would be one, and what is that going to do? It's going to anchor the serratus and the pec for better actual force production to move that barbell. So we want to train that scapular depression and the ribs here. So let's set it up again. So you do the same thing, but when you press, you're going to keep the pressure, but I just want you to think, drive, then press. So ribs down, shoulder blades down as you're pressing. You got it?
I just got a little higher. That's good. So,
hold on. A little bit of retraction there, good. And then go ahead. Once you come up, you might have to be here. And then, nice and easy. Breathe in here. Perfect. Now go ahead. You good? Bring it up. So now, go ahead. Bring it back down. And good. In the nose. Bring it down. And then activate and drive. Good. 2 more here. Good. So he's got good belly activation there. Activate and drive. Really good. Last one. Activate and drive. Now, could you feel like the shoulder was more engaged when you did it?
Yeah, more stable.
That's what I was going to hope for. It was more stable. So that shoulder felt more stable when he did that. So what muscles tend to get weak? Lower traps and serratus. What muscles take over? Upper traps, levators, and pecs. Okay? So we want to, in sports performance, this is what's cool. You not only have, there's 3 factors that can cause this. You have just the neurological pattern, can they do it? Then you have the functional capacity that we'll talk about tomorrow, where the neurological threshold above which those muscles like the serratus and the lower trap, they can't actually activate, right? You lose it. And then you actually have strength insufficiency of those muscles. At some point, those muscles cannot contract hard enough to sustain the position. So training scapular depression is super important if you want to train powerful athletes, because you need serratus, lower trap to stabilize that scap against these massive loads. You can't just do, light, easy stuff and think that like your serratus has the contractile capabilities to hold 200 kilos over your head. That's a shit ton of force that you need producing by your lower traps and your serratus. So for this, we've got the legs up. We're teaching him how to pressurize and then to anchor the serratus and the pecs and the lower traps with the oblique slings and with the pressure in the belly, right? Now, did you notice by his 3rd rep, did you notice his chest his chest elevated and his belly came in a little bit? That's a perfect example of he was over his functional capacity, so he's slowly creeping into that newborn position, which is chest elevated, back, not as much pressure in the belly, right? Now, go ahead.
It seems like it was because he was exhaling on the chest.
You would think exhaling would make it go down, but it might have been a little bit of a breathing thing.
Just habit.
Could be habit also.
Right, because you were telling me the diaphragm comes up.
But when you breathe out, the ribs would go down. Now he's under pressure. You might be right, I guess is what I'm saying. Like when you breathe out, the chest would normally go down, but you're normally not holding 135 pounds either, right? So I think, given his strength level and given his ability to do it, even though I was seeing that, now that I'm actually thinking about it, it probably was a habit thing and not necessarily a fun. Now, if I had him do 10 or 12 reps, it probably would go there. But after 3, it probably is a habit thing. You just kind of lose thinking about it.
Yeah,
you're just trying to make me look bad. What are you doing?
Back to
Yeah. So The challenge is if I say, hey, you're gonna do 5 sets of 10 reps, keeping your mouth closed, maintaining pressure takes some practice. So what you can also do, you can have him start here. So go ahead and just kind of get it, you're not gonna bench yet. So breathe into here, get that position, and it's pelvic pressure. Now that you've got that, keep the pelvic pressure, don't lose it, and keep your feet flat on the bench. So now he's still able to keep this all engaged, but now he's not holding his legs up, but the pressure's still there. So it's not exactly optimal, but it's a way that he could now hold the pressure in the belly and do the reps in a way that's not going to fatigue him. Because if your legs are up, now it ends up just being like a core exercise, and he doesn't really care about that in this position. We're trying to train his intra-abdominal pressure's ability to actually anchor the pressing muscles and the scapular stabilizers. We're not turning it into a core thing. For me, old man, I'll just do it with my legs up the whole time, but it did take some practice, but now I can do it and it's fine. For him, if we're training him for a meet, I might try to have him doing 2 or 3 reps, maybe 5 where he can do it until he gets better at it. Or if he's doing pullovers is another one that we can do. Then when this gets tired, put your feet flat but keep the pressure. Make sense? Cool. So for me, you've got the competitive bench that we showed. Then you also have the 3-month model that we showed. And then you also have the bring the feet back down and flat to sort of allow him to pressurize the belly in a way that's not so taxing on the core.
Do you set up with your feet first and then lower?
What I did to train this, I held that until I couldn't, and then in the middle of the set, I would put the feet down and keep it. And you can, I mean, truth be told, if he's up like this, let's just do it. Let's do a set of 6. Can you do 6 for 135? No, feet up. Yeah.
Like this?
Yep, good. So now, go ahead, nice and easy. And you're trying to kind of breathe into the back of the pelvis. Good. Bring it up. Good, nice in there. So now, give me 3. Go ahead, on you. Breathe in. Good. Pressurize, activate, press. 2 more. You gotta breathe, bro. Breathe in. Good. Breathe. Now, breathe in and set your feet down, but don't lose the pressure. Perfect. Now 3 more reps like that. Keep the pressure, keep the scapula activated. 1 more. Good. So, easier, right?
Yeah.
But you could still feel the pressure, and it wasn't quite as good as it was when it was up,
Yeah.
but it was a lot easier to hold that position.
Yeah.
So it's a compromised position. I can't say like, okay, everyone needs to do 6 to 10 reps with your feet up the whole time. You can actually do this when you're in a 5-month position, which is loading to the TL junction, so you're closed chain lifting the pelvis off the bench. That's a core exercise and a party trick that I no longer do. It's just sort of like, it was cool for a while, but doesn't need to do it. So in review, we went through all the reasons why the competitive bench is so crucial and you need to be training that. We want to be training out of that position either the same day. He could finish with 5 sets of 10 hypertrophy, just sort of pressing at the end, right at the end of the press right after the bench, or he could do it in his off day, his accessory day. You're going to have him in this position. Why are we doing that? 1, we want to make sure that he can stabilize and anchor the serratus, the pec, the lower traps, all that stuff with pressure in the belly and the oblique slings. And 2, we want to make sure that extension, compression, stabilizing strategy that he has to use in training is not a rigid pattern. We want to make sure he can break out of that pattern, and you do that by training this. Does that make sense? In a nutshell, that's that. Don't help up here. Any questions about that? None?
Long press.
I've seen too many broken wrists from floor press, so I don't give floor presses. You're laying on the ground, you're doing this. I've seen an ulna and a completely shattered doing that.
Yeah, because you're limited with your elbows.
It's 485 on the bar, but nonetheless. So floor press, if you're doing lighter stuff, is fine. But if you're off by the tiniest bit, you can shatter your wrist and your forearm by hitting it. And if for him, doing floor press with 135 is enough to wreck his wrist and not enough to train his body, so I don't give floor press. What you can do instead, they have them here. Where's those yoga blocks? What'd you do with the yoga blocks?
Board press?
It's a weird. You're seeing it like clips onto it.
Yeah, board press.
Yeah, sort of. Of course, he doesn't pick the one that has the notches. It'll work. So you can do. The other one has notches for a barbell.
Yeah, in case you have a partner.
Did people think it was just like a weird yoga, like a messed up yoga block?
I didn't understand where you used it.
So
I was like, why? What the heck?
you basically have it on here, and he can press like this, or you can put it like this, and he can get. Yeah, west side. That's right. This is board bench. How fun is board bench though? I mean, it's so awesome.
Oh, you can overload. It's a really big ego boost for sure.
For sure, yeah. If you want to move some plates, just
Yeah.
do 3 boards, 4 boards. No one knows what we're talking about. Basically, you would have the boards on your chest and it's working on lockout strength. You do that when you're wearing a suit. The suit literally moves the weight off your chest, so all you really need is lockout strength. So worthless for DNS, I don't even know why we're talking about it. We should have done this over beer. Any questions about the bench press?
Yes.
Yes. I was waiting, Rachel.
So, what I have learned in my own training,
I thought that was a human, so I'm just like, I hope that wasn't a head. Go ahead. What you learned in your own training?
that when you're in something like the squat or the bench, where you cannot fully reset on the rack between reps compared to the deadlift, you have diminishing marginal return on your bracing, your pressurizing strategy.
Harder to re-brace every
It's
time.
harder to re-brace. So what I was taught, and what was really a big learning curve, was learning how to breathe within the set so I didn't pass out, but keeping the pressure. And I was wondering if you could talk more about the smaller breaths that would be necessary in that to maintain the pressure.
Okay. We'll just cover all of level 2 in this class to answer questions. The diaphragm paradox that I talked about this morning. Remember that the harder you brace, the more challenging it is to breathe. Okay? So what she's talking about is not, 135 pounds. She's talking about 300, 400 plus pounds on her back, stabilizing. So for that, she probably has to have, let's just for funsies say, she probably has to have an 80, 85% brace just to stand there without her spine collapsing. That's a pretty high brace. So if you've ever seen somebody doing, squat sets, or has anyone ever done a heavy yoke carry, or even worse, like a tombstone carry, like heavy, okay? What does that look like? So if I've got a bar on my back, and I'm actually sort of like trying to squat, am I going like, every time I take a breath in and a breath out, what happens to my diaphragm? More importantly, what happens when I breathe out? It goes up. What does that do to the pressure in the belly? It diminishes it, right? And your abs can't compensate for the loss of the pressure, right? The foundation of intra-abdominal pressure is the outward pushing force created by the diaphragm. When that's gone, you can't create as much pressure. Sucking your belly in is not as good as driving your diaphragm down. So for her, what she's asking is the diaphragm paradox, and that is when you're in a situation where you're breathing hard. She's doing a set of 5, say, right? So what's your 5 rep max? 3 something, right? 350. So she got 350 on her back. She's doing 5 reps. First rep, she's good to go. But by the 3rd, 4th, and 5th rep, her heart rate is in the 150s or the 160s, depending on how fit she is, right? So what she has to do, she can't go, she's going, and she has to take these short breaths because the diaphragm has to stay down to maintain the pressure. So she can't afford to go all the way out and lose the pressure. So you have to actually train. Nasal breathing, I think, makes that easier. But then I actually have people like, for you, if that was an issue, I would be doing lighter weight, like practice, double kettlebell,
The shoulder breath, like.
Yeah, double kettlebell front rack, slow tempo squats. And I'm literally practicing the skill of breathing and bracing under way less load than 365, but you'll get way better at it when you do that. I wouldn't need to actually add what I call a heart rate accelerator in there. If you're a CrossFitter, I might have you doing that, but you're doing 20 cals on the bike. Then you're doing 5 double kettlebell front rack, 5 seconds down, 5 seconds up. And you're doing that every 3 minutes for 6 rounds. So by the time you get done, your heart rate's really high and you have to breathe. That's harder. She doesn't need that, but she could practice it with a goblet hold, with a goblet squat, with a double kettlebell front rack. I think front rack's easier to feel this, and you're less likely to crank your back on. But then you write in the programming exercises designed to train loaded respiration. That's the whole point of the exercise. That's what I would be doing with her. Does that make sense? You would just put that at the end of your workout, twice a week, 3 times a week. They're actually fun if you're weird, but learning like my favorite one, another really good one for you. Do you guys have sandbags? Oh my gosh. Do sandbag RDLs where you're holding, for you, it would probably be an 80 or 100, maybe a 120, and you're just sitting there feeling the pressure and breathing through like this. Do like sets of 10 or 15. Smokes the shit out of your whole chain there, but it trains how do you use pressure in the belly to anchor that, and you can never stop pressurizing because you're holding a 100-pound a sandbag or an 80 or whatever, doesn't matter. But that's a really good one. Tombstone hold squats are really good, single shoulder ones, double kettlebell front racks. But slow it down. 505 is probably a little too slow. 303 is better. But you want to slow it down so that you have a chance to feel, and you can breathe in and out and do that. The creepy thing is if you're nasal breathing, you can dissociate your respiration cycle from the movement. Way earlier this year, I was doing sandbag 2 years ago. And and the workout was, 10 sandbags in like a 4 meter, I can't remember. But my heart rate was super, super high, and I noticed that instead of going, my heart rate was really high, and I was just going, and I was able to move, it was an 80-pound sandbag or whatever it was, and I didn't have to breathe in at the bottom. The same thing happened today. I did 100 swings of the 80. If you could tell, as my heart rate got at 174 at the end, I started breathing heavier. And at the end, I had to breathe faster, so I couldn't go. I couldn't do it. So I was going. And because of the nasal breathing, I didn't feel less stable, and my back feels totally fine. So I've trained it, but you're just going to need to put it into your programming so that you're able to do it. And then once you practice it a little bit, 3 weeks, 6 weeks, you'll probably go in and your 5s will be way easier. When you get the nasal breathing down, you just don't have to work as hard, and you don't have the diminishing returns you mentioned. Yeah, great, killer question. Yeah?
Outside of weightlifting as a sport, would you recommend using dumbbells instead for?
Yeah, so one of the like dumbbells are,